Dear students, welcome back. In the previous session, we have finished the right ventricle. Now, in this session, we are going to see the left heart, which includes the left atrium as well as the left ventricle. So, before seeing their internal features and external features of the left atrium and ventricle, now again we'll go back to the schematic representation of the heart on the posterior view, which showing the base and the diaphragmatic surface. Yes, this is the posterior aspect of the heart and it is the schematic representation. So here you can see this part is the upper part in this one is the atrium. This is the left atrium and this part is auricle, left auricle. This forms the atrium, left atrium, and this one is the right atrium here, and this major portion is the left ventricle, and a small part of right ventricle is seen on the posterior view, especially and the base, this forms the base here, that is the atriums forms the base, both left atrium and the partly right atrium. Okay, and the diaphragmatic surface is mainly formed by the 2/3 of the left ventricle. So this is the 2/3 of the left ventricle, and by 1/3 of the right ventricle. So these are the structures we can see on the posterior aspect. Okay, here also we can see the borders and all here. So here we can see here, this one is the upper border, lower border, and the right border and the left border. So and also the heart is having an apex and the base. Base is apex is mainly formed by the left ventricle, and it is directed downwards, forwards, and to the left. And the base of the heart forms its posterior surface, this one, and it is formed by the base is formed by the left atrium and by a small part of the right atrium. This is the base and this is the apex. Okay, now coming to the borders, the upper border is slightly oblique and is formed by the two atria. So if you can see this thing, so we can see some obliquity of this upper border. Okay, and it is mainly formed by this two atria, chiefly, that means mainly by the left atrium, and very small of right atrium. This is the upper border, and the right border is more or less vertical, and this is formed by the right atrium, and this left border is formed by, which is oblique and curved, which is formed by the mainly by the left ventricle and a part by the left auricle. Okay, and this border separates the anterior and left lateral surfaces of the heart. Okay, now as we know that we have already finished this sternocostal surface both in schematic as well as this oblique structure. So now coming to this inferior surface or diaphragmatic surface. So this forms the inferior surface and the diaphragmatic surface. So this surface, this part of the heart rests on the central tendon of the diaphragm, and this surface is formed in its left 2/3 of the left by the left ventricle and in its right by the 1/3 of the right ventricle. Okay, and these are separated by a groove called as posterior interventricular groove, which is directed downwards and slightly backwards. Okay, and the left surface is mainly formed by the left ventricle. So this is the left surface which is mainly formed by the left ventricle, and this border separates. So what border? Left border separates the anterior border, anterior surface as well as the left surface of this ventricle. Okay, in the upper part, this is the another groove which is separating. This is another groove which is separating the atrium with that of the ventricles, that is the coronary sulcus. This is the coronary sulcus which is separating atria and the ventricles. Okay, and this sulcus is related to the phrenic nerve, left phrenic nerve, and the left pericardiophrenik vessels, and also the pericardium. Okay, so these are all about the structures seen on the posterior view of the heart, which is showing base and the diaphragmatic surface. Now the same features now we are going to see in the oblique position of the heart. Okay, yes, this is the oblique placement of the heart. In that is the posterior aspect of the heart. Here you can see the structures again. So this is the left atrium. This forms the left atrium, and you can see this two openings here. This is the two openings of the pulmonary veins into this left atrium, whereas this part is the left auricle. This is the left auricle, and this part is the left ventricle here. This is the left ventricle up to here. This is the left ventricle, and this part is the right ventricle, and this is the right atrium. This is right atrium, left ventricle, and this one is the right ventricle. So the diaphragmatic surface is formed by this 2/3 of the left ventricle and 1/3 of the right ventricle. This forms the diaphragmatic surface. Okay, and here you can see the upper border very clearly here. So the upper border is formed by the two atria, isn't it, which is somewhat oblique. So this, which is mainly formed by this left atria and partly by the right atrium. This is the upper border. Okay, now, and this part only forms the base of the heart, and this is the apex of the heart. Okay, and coming to the sulcus, so that is the coronary sulcus. So here, this is the coronary sulcus, this part, something is lodging here. So some artery are also lodging in this place. Okay, and this is the posterior interventricular septum. This is posterior interventricular septum, which is dividing left ventricle and right ventricle. Okay, and we have already mentioned that this is the interatrial septum, which is not clearly seen, only it is seen scarcely on the posterior aspect. Okay, and these are the openings into the left atrium, that is the pulmonary veins, a pair of pulmonary veins. So a pair on the right side and a pair on the left side. So these are the things we can observe on the posterior aspect of the heart. And here another openings we can see here, that is the superior vena cava and inferior vena cava into the right atrium, and the pulmonary veins into the left atrium. Okay, so these are all the structures we have seen on the posterior aspect of the heart. Now we are going to see the internal structure of the left atrium. Internal structure of the left atrium. So here comes the internal structure of the left atrium. Here this is the left atrium. This part is the left atrium. So the most posterior part is cut to expose the internal structure of the left atrium here. So for that reason we can see only a pair of pulmonary veins opening here, a pair of pulmonary veins. On the left side we can't see that part for the exposure of this internal structure, and we can see this left auricle. So see how left auricle is very clearly seen here. It is an appendage. So this is the left atrium internal structure. So this is the mitral wall, so which is having two cusps here. So one is the anterior cusp and the posterior cusp in the left atrium. So simply we can call it as the mitral wall. This part is mitral wall. Okay, so now we will see in detail. The left atrium is a quadrangular chamber. So that thing we have seen in the previous thing only. It is a quadrangular chamber situated posteriorly, and its appendage, that is the left auricle, projects anteriorly to overlap the infundibulum. That is, so here the left auricle which is projecting anteriorly and overlapping the infundibulum of the right ventricle. So this infundibulum gives origin to the pulmonary trunk. Okay, and the left atrium forms the 2/3 of the base of the heart, that you people know. So this forms the 2/3 of the base of the heart and the greater part of the upper border. Okay, and also it is having some parts, it forms some parts on the sternocostal as well as the left surface. So sternocostal surface we can see the left auricle only. On the left surface we can see the left atrium. Okay, so that part is cut here now, and also it forms some of the left border. So this atrium receives oxygenated blood from the lungs through the four pulmonary veins. So these are the veins which receives oxygenated blood from the lungs through four pulmonary veins, and it pumps blood from the left atrium to the left ventricle through an opening called as left atrioventricular orifice or mitral opening or bicuspid opening, and this one is guarded by a wall by its same name called as mitral wall or bicuspid wall. So this one is the mitral wall or bicuspid wall or left atrioventricular wall. Okay, so these are the general things of left atrium. Now coming to the features of the left atrium. So already we have seen in the pericardium. In the pericardium we are having two kinds of sinus. One is the transverse sinus and the oblique sinus, isn't it? Yes. The posterior surface of the atrium forms the anterior wall of the oblique sinus of the pericardium. So this structure, this atrium forms the anterior surface or anterior wall of the oblique sinus of the pericardium. Okay, and the anterior wall of the atrium, this is the anterior wall of the atrium, is formed by the interatrial septum, and it is formed by the interatrial septum. It is formed by interatrial septum. Okay, and the anterior wall is formed by the atrium is formed by the interatrial septum. Okay, and the two pulmonary veins open into the atrium on each side of the posterior wall. On each side of the posterior wall. Okay, so this is the posterior wall. So this part is the anterior wall, and this is the posterior wall where it is the opening of the pulmonary veins are seen or the posterior wall. Okay. Next, the greater part of the interior of the atrium. The greater part of the interior of the atrium is smooth walled. So the greater part of the interior, so this is the greater part of the interior is smooth walled. It is derived embryologically from the absorbed pulmonary veins which open into it. Absorbed pulmonary veins which open into it. So the same structures which are formed as a pulmonary veins, those structure only forms this interior part of the atrium also. Okay, and then musculi pectini. So we have seen this musculi pectini in the right atrium on the anterior wall, isn't it? Those are the muscular ridges which gives as teeth and the comb appearance, isn't it? And this is the musculi pectini are present only in the auricle. So if you can see this auricle, so inner side you can see some ridges. So these are the musculi pectini. These are the musculi pectini which is seen only on the left auricle only. Okay, so where it forms a reticulum, that means these fibers are interconnected. So same as in the right auricle, where this musculi pectini are in the form of reticulum. Whereas the anterior wall of the right atrium is having only a comb-like appearance, whereas in the right atrium it forms reticulum. The same way on the left auricle also it is having musculi pectini which are present in the form of reticulum. Okay, and this part develops. So this left auricle develops from the original primitive atrial chamber of the heart tube. So it develops from the original primitive atrial chamber of the heart tube. Okay, the septal wall shows. So again we come to this septal wall. This septal wall shows a lunate appearance, a fossa which is a lunate appearance corresponding to the fossa ovalis of the right atrium. So on the right atrium, on the septal wall, we have seen this fossa ovalis. So the same at the same side of that fossa, in the left atrium, also having a fossa in the form of crescent shape called as fossa lunata, which is corresponding to the fossa ovalis. That means in the embryonic life, this is the fossa which sends blood from right atrium to the left atrium in the embryonic life. After birth, this fossa is closed. Okay, so but the remnants and a depression of that fossa can be seen on both the sides. The name differs as in the right atrium as fossa ovalis, on the left atrium it is called as fossa lunata. Okay. So in addition to the 4 pulmonary veins, the tributaries of the atrium include a few vena caudes minimi. So some of the tributaries of the atrium can also seen in this atrium. Okay, so these are all about the structure, interior structure, as well as the features of the left atrium. Now in the next thing we are going to see the left ventricle. So we are going to see this, that is the left ventricle. So here this part, the exposed part is the left ventricle. Here you can see this atrium. So this part is cut in the previous pic. So this is the cut end part to expose the internal structure of the left atrium. So that is, so here now we can see the another pair of pulmonary veins posteriorly and also some part of left auricle. So this is the appendage. This is the left auricle here. Okay. Now, and here we have already seen that is the mitral valve. Through this opening only, so the blood from the left atrium will enter into the left ventricle. Okay, these are all the structures we have seen in the earlier pic about the left atrium. Okay, and this is the exposed part here. So that exposed part is this one. This is the wall of the ventricle. This is wall of the ventricle. See how much thick it is. So this wall is 3 times thicker than the wall of the right ventricle. Okay. So this is the exposed part of the left ventricle here. So the left ventricle receives oxygenated blood from the left atrium and pumps into the aorta. It is going to pump here. Here you'll have this opening here. So it is pumped into the aorta like this. Okay. It forms the apex of the heart. The left ventricle forms the apex of the heart and a part of the sternocostal surface. So some part, only the some part of the sternocostal surface, and most of the left border is formed by this thing. Most of the left border, apex, and also some part of sternocostal surface, and also 2/3 of the diaphragmatic surface. This is the 2/3 of the diaphragmatic surface. Okay, these are the general things about the left ventricle. And features. What are the features you can see externally is the same thing. Externally, the left ventricle has 3 surfaces. One is the anterior surface, that is the sternocostal surface, and inferior surface, that is the diaphragmatic surface, the surface which sits on the diaphragm, and also the left surface. The left surface is mainly formed by the left ventricle, which I have shown earlier. Okay, these are the things, these are the external features. Okay, now coming to the interior part of this left ventricle, the interior is divisible into 2 parts. So this interior is divided into 2 parts. One is the lower roughened part. This is the lower part which is roughened with trabeculae carneae. So these are the trabeculae carneae we can see here. So these are the muscular ridges. I have already explained about these muscular ridges, how the arrangement of muscular ridges are present in the right ventricle. So the lower part of the ventricle will have the same type of roughened part on the lower part, and this upper part is smooth part, and upper part is the smooth part, and it is having an aortic vestibule. Vestibule means it is a channel or an opening into the another structure. So here you can see this aortic vestibule here, and then which gives origin to the ascending aorta. Okay, and this part develops from the bulbous cordis, and this part develops from the bulbous cordis. So this vestibule lies between the membranous part of the interventricular septum. So this part lies in the membranous part of the interventricular septum. Okay, and also the anterior cusp of the mitral wall. So this vestibule is present in between the membranous part of the interventricular septum. So the interventricular septum, you can see somewhat deep to the earth, and also in between the interventricular septum as well as the anterior cusp of the mitral wall. Anterior cusp of the mitral wall. So this one is the anterior cusp and this one is the posterior cusp. This anterior cusp, which is very much nearer to this aortic vestibule, or so you can see very clearly now this one is the anterior cusp and this one so somewhat deep interventricular septum. So this is about the presence of this vestibule, which gives origin to the ascending aorta, which is located in between the interventricular septum as well as the anterior part of the anterior cusp of the mitral wall. Okay, now coming to the interior surface of the ventricle. Now coming to the interior surface of the ventricle shows two openings. So it shows two orifices or two openings. So now you have already know one opening, that is the mitral valve or bicuspid mitral opening or bicuspid opening or bicuspid orifice or left atrioventricular orifice. This is the left atrioventricular orifice, the opening here. Here it is the left atrioventricular orifice, and it is guarded by the bicuspid. So this one is the anterior part of the mitral wall and this one is the posterior part of the mitral wall, or anterior part of the bicuspid wall or posterior part of the bicuspid wall. Both are same. Okay, and another one is the aortic orifice guarded by this aortic valve. So aortic valve is also having the semilunar valve, same which we have seen in the pulmonary valves like. Okay, so these are the two openings which are present in the left ventricle. Okay, now so this lower roughened part will have this what you called as trabeculae, isn't it? These are the muscular ridges, that is trabeculae carneae, and there are two papillary muscles. One is the anterior papillary muscles and another one is the posterior papillary muscles. So as we know that the papillary muscles will have one end attached and another end is free, isn't it? So, and it is also pillar-like appearance. These papillary muscles are pillar-like appearance. So these are also one type of muscular ridges. Okay, so how many papillary muscles? Two papillary muscles. One is the anterior papillary muscle and the posterior papillary muscle. So these anterior papillary muscles is connected with that of the anterior cusp of the mitral wall by a structure called chordae tendineae. And this posterior papillary muscles is attached to the posterior cusp of the mitral wall with the chordae tendineae. Okay, these are the structures which attaches with the mitral wall to the papillary muscles. So the cavity of the left ventricle is circular in cross section, whereas in the right ventricle it is in the crescent shape, but it is in the left ventricle it is in the circular in shape, and the walls of the ventricle are 3 times thicker than those of the right ventricle. So these are the things about the interior of the left ventricle. The interior of the left ventricle is divided into 2 parts: lower rough part which contains trabecular carneae and the upper smooth part. Okay, you have to explain these 2 things. And then it is also having 2 openings. One is the bicuspid opening and also the aortic opening. And what are the structures guarded these 2 openings, you have to mention. And also you have to mention the papillary muscles which is present on the lower roughened part, how it is attached to which part of the cusps of the mitral wall, and also the thickness of the ventricle. You have to mention in the interior structure of the left ventricle, and also as a whole for left ventricle you have to present with some general features of the left ventricle and some external features of the left ventricle as well as the interior structures of the left ventricle. So these are all about the left heart. The left heart includes left atrium and the left ventricle. In the next session we are going to see the walls of the heart. Okay, thank you.